In this podcast episode, Laura Delano shares her personal journey through the world of psychiatric medication, specifically focusing on antidepressants and selective serotonin reuptake inhibitor, SSRIs. Her experiences reveal a troubling narrative about the mental health industry, the impact of medication on individuals, and the systemic issues that perpetuate the cycle of dependency and suffering. Delano begins by addressing the widely accepted notion that mental illnesses, particularly depression, are caused by a chemical imbalance in the brain. She argues that this idea is fundamentally flawed and lacks scientific backing. The concept of a chemical imbalance has been ingrained in public consciousness, leading many to believe that taking medications like SSRIs will correct these imbalances. However, Delano emphasizes that there is no definitive science to support the existence of a baseline for what constitutes a normal chemical balance in the brain. This myth has contributed to the overprescription of antidepressants, with millions of Americans relying on these medications without understanding the underlying issues. Delano points out that the mental health industry has failed to provide a clear definition of what balance means, making it impossible to identify an imbalance. This lack of clarity raises critical questions about the efficacy of these medications and the motivations behind their widespread use. The conversation shifts to the staggering statistics surrounding psychiatric medications in the United States. Delano notes that, according to the CDC, approximately 66 million Americans were on antidepressants as of 2022, a number that may have increased since then. This statistic highlights the extent to which society has become reliant on these drugs as a solution for mental health issues. Delano argues that this reliance is indicative of a deeper problem within the mental health system, where the focus has shifted from understanding and addressing the root causes of emotional pain to simply prescribing medication. Delano's own experience with psychiatric medications began at a young age, leading her to question the long-term effects of such treatments. She reflects on how the normalization of medication has created a culture where individuals are conditioned to believe that they need these drugs to function. This societal shift has profound implications for how we view mental health and the solutions we pursue. One of the more alarming topics discussed is Post-SSRI Sexual Dysfunction, PSSD, a condition that affects individuals who have taken SSRIs. Delano explains that many people experience a loss of sexual function after discontinuing these medications, with some never regaining their sexual abilities. This condition has garnered attention through a growing movement advocating for awareness and support for those affected. Delano emphasizes the importance of recognizing PSSD as a serious side effect of SSRIs, as it can lead to significant distress and impact relationships. The existence of PSSD raises critical questions about the long-term consequences of psychiatric medications. Delano argues that the mental health industry has largely ignored this issue, leaving many individuals to suffer in silence. The lack of acknowledgement from healthcare providers about the potential for sexual dysfunction further complicates the narrative surrounding antidepressants and their effects on quality of life. Delano shares her experiences with therapy throughout her journey, highlighting the complexities of the therapeutic relationship. She recounts how, despite being in therapy for nearly a decade, she often felt more like a patient than a person. The focus on her diagnosis and the medications prescribed overshadowed the potential for genuine connection and healing. Delano reflects on how therapy can sometimes become a transactional relationship, where the therapist's role is to manage symptoms rather than explore the underlying issues. This dynamic can lead to a sense of disconnection from one's own experiences and emotions. Delano emphasizes the need for therapists to foster a more holistic approach, one that encourages individuals to explore their feelings and experiences without being reduced to a diagnosis. She advocates for a shift in the therapeutic model that prioritizes empathy and understanding over strict adherence to medical protocols. The discussion delves into the implications of psychiatric labels and diagnoses. Delano explains how being labeled as bipolar or mentally ill can become a defining aspect of a person's identity, often leading to feelings of shame and inadequacy. She argues that these labels can create a self-fulfilling prophecy, where individuals internalize the belief that they are fundamentally flawed or broken. This perspective can hinder personal growth and recovery as it reinforces the idea that one is permanently damaged. Delano's own experience with being labeled as bipolar led her to question the validity of such diagnoses. She emphasizes that mental health struggles are often responses to life circumstances rather than inherent flaws in one's character. By reframing the narrative around mental health, individuals can begin to reclaim their identities and move beyond the limitations imposed by psychiatric labels. Delano discusses the phenomenon of polypharmacy, where individuals are prescribed multiple psychiatric medications simultaneously. She shares her own experience of being on 5 different drugs at one point, highlighting the potential dangers of combining these substances. Delano argues that the lack of research on the long-term effects of polypharmacy raises serious concerns about the safety and efficacy of such treatment approaches. The conversation underscores the need for greater awareness and caution when it comes to prescribing multiple medications. Delano emphasizes that healthcare providers should prioritize individualized treatment plans that consider the unique needs and circumstances of each patient. By doing so, the mental health industry can move towards a more responsible and ethical approach to treatment. Throughout her journey, Delano reflects on the importance of family and support systems in the recovery process. She acknowledges that her own family played a crucial role in her ability to navigate the challenges of mental illness and medication withdrawal. Delano emphasizes that having a strong support network can make a significant difference in an individual's ability to heal and regain a sense of agency. However, she also recognizes that not everyone has access to such support. Many individuals facing mental health challenges may feel isolated and alone, which can exacerbate their struggles. Delano advocates for the creation of community-based support systems that foster connection and understanding among individuals experiencing similar challenges. By building these networks, we can help combat the loneliness and despair that often accompany mental health issues. A critical aspect of the discussion revolves around the concept of informed consent in the context of psychiatric treatment. Delano argues that many individuals are not adequately informed about the potential risks and side effects of psychiatric medications before starting treatment. This lack of transparency can lead to individuals feeling trapped in a cycle of dependency without fully understanding the implications of their choices. Delano emphasizes the importance of empowering individuals to make informed decisions about their mental health. This includes providing clear information about the potential benefits and risks of medications, as well as alternative treatment options. By fostering a culture of informed consent, the mental health industry can help individuals take ownership of their treatment journeys and make choices that align with their values and goals. The podcast also addresses the significant influence of the pharmaceutical industry on mental health treatment. Delano highlights how marketing and advertising have shaped public perceptions of psychiatric medications, often downplaying the risks and emphasizing the benefits. This commercialization of mental health has contributed to the normalization of medication as the primary solution for emotional pain. Delano argues that the pharmaceutical industry's profit motives can compromise the integrity of mental health care. She calls for greater scrutiny of the relationships between healthcare providers and pharmaceutical companies, advocating for transparency and accountability in the prescribing process. By challenging the status quo, we can work towards a more ethical and patient-centered approach to mental health treatment. As the conversation draws to a close, Delano reflects on her own path to recovery and healing. She emphasizes that her journey has been marked by a deep exploration of her identity, values, and purpose. By letting go of the labels and narratives imposed by the mental health industry, Delano has been able to reclaim her sense of self and find meaning in her experiences.